Hello again. Welcome back to the Critical Care Practitioner videocast. I was going to say Facebook page, but I'm putting it on YouTube as well. It's going everywhere. Hey, why not? For those of you that don't know me, I'm an advanced critical care practitioner in the UK, in Birmingham, in the Midlands. COVID is becoming a major part of all our lives for one reason or another, certainly as healthcare professionals, and for everybody really who's being restricted. Lives have changed. This is a series of videos, the COVID Chronicles, I've called them, to give them a bit of a pompous title, but this is about me trawling Twitter and trying to find resources that we all might find useful. I'm saying this on every video because I think it's true. You can hear me, yes, because I think it's true. If you're not using Twitter, you perhaps ought to give it a go, because there are a lot of resources out there that you can find, people pointing it out to each other. It's not just people tweeting trivial nonsense or Donald Trump tweeting trivial nonsense. There's some really good stuff on there, so go and use Twitter. I may do a teaching video of how to use Twitter if that's what people want. If enough people ask me, I'm happy to do that. It's relatively straightforward. It just takes a bit of practice. Oh, my Labrador has wandered in. Hello, Callie. Here she is. So if you wanted me to do that, I could, but if not, use Twitter. And I always say it's not who you follow, it's what you follow. Using the hashtag COVID-19 will get you a lot of rubbish, but it'll also get you a lot of really valuable stuff. So without further ado, let's go to my screen and I shall show you what I found for us today. So transition. I have to keep reminding myself because I've forgotten several times and I have to remake these things and it gets really annoying. I've got the brain of a banana. Okay, so what have I found for us today? So let's scroll down a little bit first. So I'm going to go to this one first. So this is tweeted by Karen Downs, which is at Karen Shovelton. Karen is, what is Karen as she told us? She's a critical care outreach practitioner. I'm not sure where, in the UK, but I can't tell you more than that. But basically they did a nursing assessment video, which is here. On Vimeo, so you can see it there. If I just press play, I'll mute it if we can hear sound, because I don't want sound. Okay, so this is the video. This is the nursing assessment of the patient that has been proned, and the process that you will go through to ensure that your proned patient is still okay. So you can see this patient is flat on their back. Some of the graphics are a little bit hard to read, but probably worth trying to read anyway, because the guy on the left is a consultant, the guy on the right is a nurse. It's going through the whole assessment of the patient that is proned, which is something that we're going to be doing regularly and is quite important. So the links again are all in this post, so go help yourself, go have a look, let me know what you think. The next thing I saw was this. Now this looks like a really valuable resource. This was tweeted by Zach Nefron, at Zach Nefron. I don't know who he is because he's not told us. Looks like he's relatively new to Twitter, but he's tweeted this anyway. So this is the Society of Critical Care Medicine, which is the American society, is offering a free course for non-intensivists. So I went to the page and I put the link below, and they're calling it Critical Care for Non-ICU Clinicians. You do have to sign up. They want a few details from you, but it's not much. Name, your address for some reason. Just a few bits and pieces. It doesn't take a second, and when you do, you then get to this page where you click on access resources, and that will then take you to this page. And it looks like this could be really valuable for those non-intensive care people or people who need a bit of a revision session. So let's go and have a look. Let's look at mechanical ventilation, as I've just made a video on that. Theirs may well be better than mine.
Describing the use of both conventional invasive mechanical ventilation.
Can you hear that?
And non-invasive mechanical ventilatory support.
I don't think you can hear that, but basically this looks like a very good guide. Yeah, this looks like good quality stuff for you to look at, so you can look at that in your own time. I'm going to shut him up now. But there's lots of different things in there. So mechanical ventilation, airway assessment and management. Oh, this is brilliant. There's great stuff in here. Great stuff. So, I would highly recommend that this is something that you go and look at. And again, I've put the link below. It's not going to cost you anything. It's being offered for free. You just need to sign up just so that just so that you can keep in touch. So that's Society of Critical Care Medicine. And what they're calling it again, critical care for non-ICU clinicians. So very, very valuable. Go there. It looks brilliant. And I probably will go there myself because, hey, who doesn't need a bit of revision? Okay, and then the next one I went to, which is on a similar vein, actually, the Society of Critical Care Medicine have just released some guidelines on ventilation of the COVID-19 patients. And this is by Ollie Poole. Now, if you listen to my podcast, which you can find in iTunes, Critical Care Practitioner Podcast, there's a bit of a plug, but hey, so what? Ollie Poole was a respiratory therapist over on the other side of the pond, and he and I did some podcasts on mechanical ventilation, so you can go and find those back in my archives somewhere. He then trained to become a doctor, and he's now qualified by the look of it. Ollie's lovely, he's a lovely chap, but he has produced this summary of the ventilation, the SCCM ventilation COVID-19 guidelines, which is here. Let's just move it forward so you can see the kind of stuff it does. And he uses very much a chalk and talk type style, which works very well. He's got better writing than me, so you can actually read what he's writing, and he's got a better technique than me. So his videos on mechanical ventilation are always also worth watching on his channel. For example, you've got this one here. So, let's skip the advert. Bear with me a second. So you've got this one here, which, for example, is talking about total cycle time and IE ratio, and he explains it really well. He explains it better than I can. Explains it really well, breaks it down beautifully, writes it beautifully, draws nice diagrams. So if you do want to understand ventilation a little better, as well as the video I've just pointed you to, go to his channel, Respiratory Review. It's called. There it is, Respiratory Review. Well worth going to if you want to learn about ventilation. I'm going to start tweeting his stuff out a lot more because I don't think his channel gets the attention that it deserves, and certainly now that ventilators are becoming so important. So let's shut Ollie up. So that's the resources I want to point you to today. I'm going to keep trawling for Twitter. Let's just get rid of my main screen. I'm going to keep trawling Twitter to find these resources. I'm also producing videos on YouTube, on my YouTube channel, and on Facebook as well, Critical Care Practitioner Facebook page. So if you want to go there, you can see some of the stuff that I'm producing there. All of this is tweeted on Twitter as well. So if you want to follow me at CC Practitioner on Twitter, by all means do, and I'm trying to keep people as informed as possible. Okay, stay safe. Speak again soon. Stay safe. Speak again soon.